Welcome back to Urgent Care Unscripted. My name is Barbara Ronalter. I am the Director of Operations and Business Development for AFC Urgent Care.
And this is Mohammed Zaman. I'm the franchisee and owner of AFC Urgent Care West Haven. Today we want to talk about urgent care versus emergency room. More precisely, when you have some kind of an illness and you're trying to decide where to go, should I go to an urgent care or emergency room? We want to talk about that, and what are the most common scenarios that you would face when you're trying to make that decision.
Yeah, today we're joined by Dr. Felix Pacheco. He is our medical director and also a veteran ER physician. So welcome, Dr. Pacheco.
Hello, thank you for having me. I would like to add that, a lot of urgent complaints are seen in emergency departments that can adequately be handled in urgent care setting. Think about your cuts, your sprains. If you're able to walk on it and you're able to breathe fine, you could probably be seen at an urgent care.
Got it. And so these are some of the scenarios that you just mentioned, Dr. Felix, that are not complex enough for people to warrant an urgent emergency room visit, I guess, right?
Yeah. And I mean, sometimes it's hard to tell, but either way, our providers could make an assessment fairly quickly and determine whether or not, a higher level of care is necessary.
That's great. I think one point is to think about, is this a straightforward case? Is it going to require, an MRI or a CAT scan? Obviously, not every patient knows that, but it's good to call. You can always call us and we can at least guide you one way or another.
Yeah.
But once the patient has actually arrived, say the patient has made the choice to come to an urgent care, how does the provider make that distinction? Should the patient be treated here, or should the patient actually go to an urgent emergency room?
Sometimes it's the initial basics evaluation, how the patient appears. Getting vital signs makes it a little bit more objective. Getting blood pressure, heart rate, temperature, and such. But laying eyes on the patient to see how much distress they're in. That said, some things are kind of difficult. If you're coming in for a trauma that maybe hasn't fully manifested yet, maybe you have some internal bleeding that is unidentified, and you may be stable because you're young and healthy and you work out. You may be like that for a while, and it will manifest later. But at least somebody, getting a history, determining the severity of the injury, and, making the best judgment as to whether or not that needs to be seen in an emergency setting or in the urgent care setting.
And I would also say risk assessment, right? So if you have a patient who is a little bit older, who has diabetes, heart disease, those are things that we take into account before we make the decision of we're going to treat you here versus we're going to send you out to the emergency room.
100%. Completely agree. Any assessment requires a risk assessment of the patient. How old they are, how many comorbidities, how many illnesses they might have. That changes the presentation of illness and the types of disease they may be susceptible to.
So it just sounds like it's not like a very straightforward decision. For the provider, they have to go through diagnosis. They have to hear out what the condition from the patient and do some tests, and then maybe make that call like, okay, yes, we can treat that patient here, or no, it is in a stage or condition that needs advanced diagnosis and so forth.
Yeah. And, there's a lot of gray. If you try to keep it simple, if you have like a 10-year-old that got cut playing with like a little knife or something and just has a small laceration to a finger, and it's very deep, right? Then you have a high speed, car accident, rollover, and the patient didn't have their seatbelt on, and they lost consciousness. Those are kind of clear examples where one very easily can be dealt with in the urgent care, and the other not. Right?
One thing that I see too with when it comes to lacerations, at least from the provider's perspective, is having, face lacerations. At the end of the day, if you want that to be done by a surgeon or, like a plastic surgeon, you're going to have a scar if you get it done. We can do it, but You
Yeah.
might have a little bit of a scar that is not so nice to look at.
That said, most ERs are not going to have a plastic surgeon available
True.
to do that kind of repair, but they may have some other surgical specialties that may make the wound look nicer. So that is true. I mean, it depends on the complexity of the illness and the concern the patient may have regarding cosmesis. How much it'll affect their look.
One thing that I also wanted to mention, just mentioned for the patients here, is you know your body better than anybody. So if you feel like you should go to the emergency room, do that
Yeah.
for sure.
And again, we have people on site that if you're unsure, the benefit of urgent care is ease of access,
Yeah.
time. And time is a big one. We typically are able to see patients within an hour of their arrival, potentially even have the patient discharged within an hour of arrival. Obviously, that all depends on how busy it is. But either way, in an emergency department setting, depending on the time of year, you'd be lucky, happy to be seen within 2 hours usually. Oftentimes longer than that. So time plays a role. Insurance, how much you pay in your copay, that obviously there are some motivations from an insurance perspective regarding trying to drive patients to urgent care versus emergency department care. But either way, there's a cost to that may be considered by the patient depending on their carrier.
But at the end of the day, like at our urgent care in West Haven, AFC urgent care in West Haven, I would say in any urgent care, I mean, patients' health and interest is the top and only priority, I would have to say, right? And their health is the priority. Nothing else really matters from just a human perspective and also from legal perspective. If you have a condition that's not within our scope, we will be in trouble to try to do anything about it. And it would be best served for us as well as for you when we refer you to an emergency room instead of trying to tackle it at the urgent care. So that's not something bad for you that we could not or failed, quote unquote, to treat you at the urgent care, that we referred you to the emergency room. That's for your best interest. And we would do that often when we see that that's the condition that needs to be treated, you need to recover, and it's for your best interest that you should go to an emergency room. So you're welcome to come here, but then we will also make the best decision that suits your needs the best, right?
Yeah, definitely. Health in mind first. And this is where we have to adjust maybe the patient's expectation.
Yeah.
They maybe thought it was minor, and then we find out that it's something that is a little bit more than we can handle. And, we want to make sure you have the best outcome. We want you to be able to walk again, be able to see us again, be able to be happy with the care you receive. And it would be a problem for everyone if, an emergency was attempted to be treated in a non-emergency setting, without the appropriate resources.
Absolutely. And coming from somebody that has worked with hundreds of providers in an urgent care setting, I could definitely say that if we're sending you to the emergency room, it's because that provider really can or already did the best that they could for you in that situation. It's not because they don't want to treat you. It's not because they don't want to, do whatever it is that you need to do. It's really for the best. So just trust the process is what I'll say.
Yeah. And it's always kind of interesting because, it can be a fairly straightforward evaluation on a patient, that depending on the patient and the expectation, it's taken easily or not. So
yeah,
we have to roll with it,
Sure.
Yeah, absolutely. And, providers are humans. So at the end of the day, some might have more capabilities than others do. Comfortability, I think it's a big thing too within the provider network system. So just keep that in mind as well.
Yeah, you touched on another point. The provider, some are greater risk takers, probably not a good term, but are willing to take on more responsibility. And everybody's a little bit different. So each provider, may make a different assessment with the same patient depending on how much responsibility they want to have over that condition.
Yeah. You guys are not robots, so.
Yeah. And actually, one thing I forgot to mention, the severity of the pain also plays a role, right? So one can argue that kidney stones aren't a life-threatening condition most of the time, but the severity of the pain is difficult to manage in an urgent care setting. So, if you have like severe pain, it's probably not going to be great to be seen in an urgent care setting as well.
Yeah, absolutely. Trust your instincts and don't hesitate to call. Don't hesitate to call your local urgent care, us, and say, this is what I'm feeling. Should I come here? Should I go to the emergency room? We'll do the best to kind of guide you ahead of time. And again, we might say, come and see us. We'll try to assess you. And if it's something that we can't do, we will send you to the emergency room as needed.
Yeah.
Thank you so much, Felix, for joining us today. That was some really insightful information. I think our patients will definitely appreciate it.
Thank you. See you next time.
Stay informed and stay safe, and subscribe to Urgent Care Unscripted. We look forward to seeing you again for the next episode.
Yep, and keep in mind, we are located at 354 Sawmill Road in West Haven. Come see us anytime you need us. Thank you. Bye.